Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services for North Carolina. And with me today is Director Mike Sprayberry. Valerie McMillan and Brian Tipton are our American Sign Language interpreters. And working behind the scenes are our Spanish translators, Jackie and Jasmine Matevier. I'll start with a rundown of the numbers. As of this morning, there are 13,397 laboratory-confirmed cases in 99 counties in North Carolina. 525 people are currently hospitalized, and sadly, we now have over 500 deaths at 507 as of this morning. Yesterday, North Carolina Food and Nutrition Services participants received some good news. They can now purchase groceries online using their electronic benefit transfer card, or their EBT card. This will allow some families to order groceries at home and lower their risk of getting sick. But that's not all. Many people across the state live in communities with limited access to affordable, nutritious food. The ability to purchase food online provides options for people living in food deserts, and that's a good thing. I encourage EBT realtors to pursue approval from the USDA to become an authorized online realtor. So good news moving forward there. It's also National Nurses Week, and I want to give a huge shout out to all the nurses who've been working so hard to help protect our state and our country from COVID-19. Your hard work every day is so important on the front lines. My mom is a nurse practitioner, and I know the dedication and the sacrifice it takes to care for members of your community day in and day out, and I've learned so much from her. I know it's a tough job on the best of days, and now, in the face of COVID-19, with the risk that it poses to you and your family, you persevere. Thank you, nurses, for every minute of the work you are doing. And I've talked a lot about the importance of continuing to get health care, that we know that people need to be managing their diabetes or their high blood pressure, and we want to be sure everyone is in the best health possible, so if they do contract COVID-19, they'll still be in the best position possible to fight it off. In addition to taking care of chronic diseases, it's important to stay up to date on immunizations, particularly for our kids. I know parents may be wondering and trying to figure out how best to keep their children and families safe during all of this. Many pediatric practices and family medicine practices have made adjustments to minimize risk, like asking people to call and wait in their cars so that they can go straight to an exam room when it's ready and to avoid the waiting room entirely. Vaccine-preventable diseases, such as measles and mumps, are still a threat to our kids and can cause serious illnesses and hospitalizations in children. I encourage you to call your doctor, clinician, or call your local health department to talk about how to safely stay on schedule for all of those important vaccines. And finally, if you do leave home, remember your 3 W's. Wear, wait, wash. Wear a cloth face covering if you're going to be with other people. Wait 6 feet apart. Avoid close contact. And third, wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. We need everyone to know those 3 W's. So go visit our website, ncdhhs.gov/COVID-19, to download and share social media posts and flyers about those 3 W's. You can make a difference to protect your family and your neighbors. Let's keep looking out for one another and staying home to save lives. Thanks so much. And with that, I'm going to turn it over to my colleague, Director Mike Sprayberry.
Thank you, Madam Secretary. Today is day 59 of the State Emergency Operations Center's COVID-19 response. As we continue to obtain personal protective equipment, we've delivered to 36 counties and 1 regional health care coalition yesterday, with masks, face shields, goggles, gloves, thermometers, and hand sanitizers. Gowns remain very difficult to obtain. Internet access for student learning is improving thanks to mobile Wi-Fi spots provided by our vital private sector partners. Hotspot devices are being delivered to 29 counties beginning this week. Those hotspots will be deployed on school buses and sent to communities to help students connect to school online. That's good news. You can visit the website at ncbroadband.gov/COVID-19 to learn where these buses will be and where other available Wi-Fi hotspots are available for student use. NC 211 remains active and ready to take calls related to your COVID-19 needs. 211 call specialists have helped people on more than 38,000 calls since mid-March. They can help with needs like food, rent, and disaster payments. Just call 211. As we've been discussing all week, we're in Hurricane Preparedness Week, and today's focus is on strengthening your home. Of all the hazards that come with hurricanes, flooding is the most damaging. As stated yesterday, having flood insurance is the best thing you can do to prepare for flooding. There are some additional steps you can take to strengthen your home as well. To help mitigate wind damage, you can keep trees well trimmed. Secure lawn furniture and loose objects before a storm. If you have generators, make sure you regularly test and maintain them, and always make sure you do that outdoors. At readync.org, you can download a copy of our brand new North Carolina Hurricane Guide with more information on preparing your home or business. Be sure to check your family emergency kit and make sure it's ready. If you don't have a kit, visit readync.org to find out how to assemble one. Adding wipes, hand sanitizer, and face masks to your kit will help keep your family healthy during this pandemic event. I'd like to echo Dr. Cohen's remarks regarding National Nurses Week. Here's a hearty hand salute to all the nurses who work so hard, not only during this pandemic crisis, but all of the time. They are decisively engaged in the fight against COVID-19. She also gave out some great advice on keeping immunizations up to date. It's so important for our children. As always, thank you for your efforts to follow the governor's instructions to stay home and stay distanced. Keep up the good work, as you are the ones that will help us work our way out of this situation. Remember to wear, wait, and wash to stop the spread. That's wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. Wear, wait, and wash. That's what's going to help us to ease restrictions in our phases and protect our vulnerable populations. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you so much. And now I'll turn it over to Madam Secretary for questions and answers. Ma'am, you have the floor.
Great. Thank you so much, Director. And I know we were having a little technical difficulty with the questions, but we'll see if we can turn over to questions.
We'll take our first question from Liz Schlemmer at North Carolina Public Radio.
Hi, this is Liz Schlemmer from WUNC. My question is for Dr. Cohen. The latest DHHS report for new cases showed the largest daily jump yet in new cases. And I wanted to ask, how can North Carolinians be confident and feel safe with the phase reopening, given that there have been so many new cases just in the last day or so?
Liz, thanks so much for the question. And yes, you are right. We did have our largest day-over-day increase in new cases, and we continue to watch these trends closely. As we know, we were already trending up in our case numbers, and when we earlier in the week sort of put together our overall look at where we are in North Carolina and in our scorecard, if you will, there was already a red X on cases. We knew we were trending up. But for me, as I think about whether or not we're ready to ease restrictions, we really have to look at the full picture of all of those metrics. We always said we can't just look at one in isolation to make decisions going forward. So we look at all four of those trends that we've been talking about, our surveillance trends, which were going down, and then importantly, the percent of positive tests in the context of total testing being done. Because we know that we have been ramping up our testing. We're doing more testing. Yesterday was a huge testing day for us. It was something like 8,000 new tests. And you saw percent positive of that stay pretty low, 6%, 7% for day over day. And that continues to be a good trend. So we know we're testing more. We know there was more virus out there. So we knew we were going to find more cases. So as I see those numbers, I think it's definitely something we want to watch. We know we are not perfect. We know this virus is here with us. That is why as we move forward, we didn't say let's throw open everything all at once. We said we have to take a measured approach. We see our case counts going up. We know the virus is here. We have to be measured about this. That's why phase one, as we think about easing restrictions, focused on lower risk activities as we think about transmission of the virus. So we focused on activities where if you are indoors, they're largely activities where you walk around and not sit. So we were thinking about activities, so going into a retail establishment like a bookstore or a florist or a clothing store. You're going to be walking around when you do that, as opposed to something like sitting in a salon or sitting at a restaurant. Those are higher risk activities. They're not ones that we won't see us moving to. We just said, let's start with the lower risk activities as we do this phased approach, and let us get used to doing the 3 W's, the wear, wait, wash, as early with these lower risk activities, and then we can move on. It's exactly, Liz, your point of that we aren't perfect here. We have to take precautions as we go. But as a whole, I still think we are largely stable with our trends and metrics. We'll continue to watch them, but I feel comfortable where we are in terms of moving forward starting tomorrow. Thank you.
Our next question is from Will Duran with the Raleigh News and Observer.
Hi there. I had a question about racial profiling regarding the mask rules. Have there been any reported cases of people wearing masks being profiled based on their race or their ethnicity? And if so,
To the question, and an important topic, because we think it is really important for everyone to wear a face covering, but we know that not everyone moves through the world in the same way, and we wanted to call out incidents of concerns related to racial profiling or others. We've seen it in other parts of the country. I haven't heard of any reports here in North Carolina, but we wanted to be proactive about saying that that is something we are on guard for, that should not be happening, and if it is, to be reporting that to local law enforcement. So I can follow up with you to see if any have been reported to date, because I know folks have been good about wearing face coverings when they're going out to essential businesses thus far. So I could see if that has happened. I know there have been reports of this in other parts of the country. So we wanted to be as proactive as we could here in North Carolina, because that is something we don't want to see here. Thank you.
Our next question is from Elizabeth Ann Brown at the Asheville Citizen-Times.
Hello, this question is for Dr. Mandy Cohen. I'm Elizabeth Ann Brown with the Asheville Citizen-Times newspaper. My understanding is that many of the state parks and several state and national forests are planning to reopen on May 9th. According to Gorges State Park in particular, they're anticipating all-time record crowds. And I can't help but wonder about the possibilities for these trailheads becoming flashpoints for virus transmission. Is it worth the risk to reopen these parks?
Thanks, Elizabeth Ann, for those questions, and thanks to those who are working to get our parks ready to be reopened. So, look, these are all places where we need to be cautious as we go forward. So as someone is thinking about, will I go to a park this weekend, I think folks want to first evaluate their own personal health risk as well as their family's personal health risk. If it is someone who is over 65 or has underlying health conditions or immunosuppression, they may want to be still staying home right now. For others, they want to take advantage of the fact that these parks are open, the fresh air. We want folks to get exercise and get outside, but we want them to be cautious as they do it. It goes back to the 3 W's. We know this virus is going to be with us. It's going to be with us till we have a vaccine. So I think we're going to have to be very aware of the wearing of face coverings, washing our hands, and waiting 6 feet apart. So I would say if you go to a park and you notice it's very crowded and that makes you feel uncomfortable, maybe there's another spot for you to check out to explore. I'd really hope that we can all be good neighbors and citizens to each other. And if we see that there are folks, there's a narrowing in a path, step over to the side and let folks pass and try not to be gathering close together. I've seen that collegiality already here, just as I walk on the Greenway here in Raleigh or down the sidewalk in my neighborhood. So I'd encourage folks to just be good neighbors to each other, to try to wait 6 feet apart, to wear your face coverings, wash your hands, and if you're hiking, bring some hand sanitizer with you. And I think if we do all of those things in combination, then we'll be in good shape. I do think that folks need to understand their own personal health risks and take appropriate steps for themselves as they think about what's right for them and their family. But we're all going to have to be in this together to work through this. I do think it's a good measured step forward as we open these parks, but I hope everyone can abide by the guidance that we've put out. Thank you.
Next question is from Erica Bryant at WSOC TV, Charlotte.
Yeah, my question is about correctional facilities. What is the status as far as inmate testing, treatment, and providing masks, access to soap and hot water, strict social distancing, and other measures?
Erica, thanks for that important question. In our correctional facilities, obviously it's been very important to identify anyone who has had symptoms of COVID-19, cough or fever, get them tested, and then understand if they had contacts and test those. I know in correctional facilities where they've been finding COVID-19, then folks went about testing the entire that entire jail or entire prison, and so I think that work is important. I know that they have worked with our team in public health to make sure that they're implementing the infection control measures that are needed in terms of cohorting patients, getting to testing, washing hands, social distancing, all of the things that we have been talking about. So I know that work is ongoing, and so there have been, we do post on our website the places where there have been COVID-19 in some of those correctional facilities and where testing has been done to understand the virus further. Thank you.
Next question is from Julie Havelock with the Carolina Journal.
Hi, thank you so much. I wanted to ask about how the age demographics are influencing your plans for the stay-at-home orders, given that some 86% of the deaths are within those 65 or over. So sort of how are you responding to those demographics, and sort of what are your plans going forward?
Thanks, Julie. I think so you broke up for a second there. I think your question was, how are we thinking about demographics in terms of our decision making for going forward, and saying that some of the, we see more of the deaths in those that are above 65, and that is exactly right. We know that being of higher risk for severe reaction to COVID-19 has you being either 65 or older, or someone with a chronic disease like diabetes, high blood pressure, asthma, immunosuppression. What we shared earlier in the week were some data about North Carolina in terms of health status. And what we see in adults, that more than half of the adults of North Carolina are either over 65 or have a chronic illness. So we showed data that even our 18 to 25-year-olds, 25% of them have an underlying chronic disease. Could be high blood pressure, could be diabetes. From 25 to 40, again, another third. So this is something where there are risk factors regardless of age. Yes, many of our deaths have been in over 65, but then we see the other deaths are often linked to these chronic diseases. And unfortunately, the way that this virus works, right, is when it spreads through the community, it means that there is more opportunities for those who are over 65 or with those chronic diseases could pick that up. There are some who are still our essential workers, have to go to work every day. We want to be protecting our friends and neighbors. So as we think about these strategies, it really is about a collective. So even if you aren't 65, if you aren't someone with chronic diseases, your actions are protecting your neighbor, your friend. I bet we all could think of someone who we know that might have high blood pressure or diabetes or asthma or fighting off cancer or what have you. I think we all know someone like that in our world. And every time you follow the 3 W's, wear your face covering, you wash your hands, you wait 6 feet apart, you're a hero and you're helping those folks in your lives just to make sure there's less virus around. Because if there's less virus around, it's going to be less likely that those folks are going to catch it. So it is truly about our actions on the many that do impact so much of our folks who are higher at risk. So that's why we really need everyone's help here, not just thinking about those who are at higher risk. So we keep the virus spread low for everyone, and it protects those at higher risk. Thanks for that, Julie.
Next question is from Holden Kerwicki with CBS 17.
Dr. Cohen, April 27th, you announced that DHHS was partnering with Community Care of North Carolina and the North Carolina Area Health Education Centers to form the Carolina Community Collaborative, and that 250 workers would be hired for contact tracing. Who's responsible for paying those employees, and how are those companies selected? And I may have a follow-up question.
So in terms of let me start with who pays that. So that is funding from the Department of Health and Human Services. There was money both from, we haven't decided if is that money that is going to be used from CDC or is that the CARES Act money that was just distributed by the General Assembly. But that is how those folks will get paid through a contract with those organizations. The way this organization was selected was through an evaluation committee looked at a submission of their proposal of what they would do for the state of North Carolina. I believe we compared at least 2 different organizations that were able to serve all of North Carolina. We had a number of organizations that said, we can serve the West, we can serve the East, we can serve Central. We were really looking for a partner that submitted a proposal that could serve the full of the state. We asked for them to have experience working with our local health department as well as our data systems because we needed to get going so quickly. We had an evaluation committee that was formed that was under the person who runs procurement for the Department of Health and Human Services, Iris Cooper. That evaluation committee evaluated the candidates on the criteria, selected that, and that's how we came up with the final partner, Community Care of North Carolina.
Follow-up. I spoke with a senator today who said he would be calling for an ethics investigation after it was revealed that Community Care of North Carolina is State Health Director Elizabeth Tilson's former employer, and Area Health Education Centers list her husband as their director. Would DHHS support an investigation into how those contracts were awarded?
Yes, I welcome the transparency on this effort. Dr. Tilson is obviously an incredibly important member of our team, but she was very aware that she did not want to have any violations of ethics here, so she was definitely not part of the selection committee nor the evaluation process here, so we welcome answering any questions about that going forward.
Next question is from Ken Smith with WRAL-TV.
Dr. Cohen, thanks for taking my call. Ken Smith at WRAL. How important is information from antibody testing, and will the state collect and release that information on positive results from local health departments? Also, why does the state mandate reporting of negative results so we can see a percentage of people who actually show antibodies?
Thanks, Ken. I don't know if I caught the second half, but let me start with antibody testing. Do you want to repeat the second half? It was something about negative reporting, but I didn't catch all of that.
Yeah, why doesn't state mandate reporting of negative results so we can see a percentage of people who actually show antibodies?
So let me start with antibody testing overall, because antibody testing is not as simple as positive or negative. There's actually there's a scale of how someone reacts and how much antibody that they have. So again, antibody testing is one that you do. It's a blood test that you go back and look, was someone exposed to COVID-19 in the past? And there are different kinds of antibodies. There's short-term antibodies and long-term antibodies. And so doing the test for antibodies is also a timing issue. You want to make sure you get it right so that you actually can catch the right amount of circulating antibodies in the body. I will also say that we're learning a lot about how to interpret and then how to use antibody tests to understand exposure and prevalence here in North Carolina and what does it exactly mean. I think we also don't know how long do these antibodies last. I think we know it confers immunity for some period of time, but since COVID-19 is so new, we really don't know what does it look like 6 months from now since we just are having our first cases in the last couple months. So there's a lot to learn still about antibodies. So that's why I think we are still evolving our thinking on how are we going to use this, who are we going to recommend it to, and then how do we think about reporting and all of that interpretation. It's not quite as clear as the diagnostic test, which tells you, do I have COVID-19 right now? That's the nasal or nasopharyngeal swab test that we do that tells you, do you have live virus right now in your body of COVID-19? That's a little bit more clear, but even those tests have false negatives. If maybe you don't pick up enough virus on the swab that you're using, you could get a negative result when you're actually positive. You know, depending, we're trying to make sure that we're getting the highest quality tests we possibly can. So what I would say on antibodies overall is still a lot to learn, clearly going to be important, but I think there's a lot of science to be done. And I think we're doing that science, not just here in North Carolina, but really around the country and around the world to understand what are the best antibody tests, number one, how should they be used, what does that mean in terms of conferring immunity and for how long a period of time. So stay tuned with us as we learn more about antibody testing overall. Thanks.
Our final question today will be from Andrea Blanford at ABC 11.
Hi, Dr. Cohen. It's Andrea Blanford with ABC 11. Can you clarify what is happening with parks and swimming pools in phase one? For parks, the executive order states that reopening is only encouraged with a ban still on the playground. So we're seeing our state parks beginning to roll out reopening plans for the weekend, but they differ depending on which park you're visiting. Others, like city parks, they have different timelines for when they'll reopen facilities like bathrooms. So there's just like a lack of consistency there. And we've heard you and the governor say that confusion around what's allowable and open and what's not is dangerous right now. So what should all of our parks be doing in phase one? And then for pools, are they opening in phase one? Is there a difference for neighborhood pools versus public pools on things like capacity limits, social distancing requirements? Thanks.
Thanks, Andrea, for that. Let me start with parks and then I'll move to pools. So what we are doing is encouraging parks to open starting Friday. They're not required to open. We're encouraging them to open. Again, we're trying to give permission to reopen activities that are lower risk. And we know walking through a park, enjoying the outdoors, getting some exercise, that's a lower risk activity. Now, there are some things within the park that we know continue to be higher risk, like the playgrounds. And so we have talked to a number of folks in the parks space that have talked about we're going to open the parks, but we'll still keep the children's playground closed. So we would like to see that playgrounds remain closed, but the parks themselves generally open. As far as swimming areas and pools, those are to remain closed for phase one. And really that is more to do with what happens sort of around the pool. As we know, when we all go to pools, we often then sit around by the pools, and it's a slightly higher risk activity. That's something we're contemplating for and are planning for phase 2. But we were saying to have those pools to stay closed for phase 1. So pools can open for phase 2, parks open for phase 1. And again, when we are saying they can open, that is our recommendation. They are allowed to open. Parks, are going to have to work on bringing their workers back, cleaning their restrooms, getting their facilities ready. So, it doesn't mean they have to open this Saturday. So I would encourage folks to, call or check out websites to see exactly which parks are open. And then I'll leave, because I know this is our last question, just leave with a reminder, is that we all just have to use our good judgment here as we go forward. This is going to be a constant theme as we go forward, is about using our judgment and protecting ourselves and our community, making sure that you bring a face covering with you, make sure that you're bringing hand sanitizer with you when you go to the parks, just in case a bathroom isn't open and you're not able to wash your hands. And of course, to stay 6 feet apart. So those are the things we're going to continue to want to keep saying over and over, and I really appreciate the press corps and others sharing those important messages to protect all of us as we go through this together. I think it's a good step forward for us to ease these restrictions, go forward with some of these lower risk activities. We need to do it carefully so we protect each other, and hopefully so that we can go forward into phase 2. All right, thank you so much for the time. Great to be with you. Have a good afternoon.